Health Organization is now declaring Mpox a public health emergency of international concern. Right now, there are cases of Mpox surging in the Democratic Republic of the Congo and other African countries nearby. And joining us now to discuss this is Dr. Jayne Morgan, Vice President of Medical Affairs at Hello Heart. First off, good morning.
Good morning, Natalie.
So can we just get first into what is Mpox and how does it affect your body?
Mpox is a virus from the orthopox virus family. This is important because it's similar to smallpox as opposed to chickenpox. Many people think that it's very similar to chickenpox, and if they've been immunized against chickenpox, then they're also protected against Mpox. And this is absolutely not true. It is in the smallpox family. This virus can cause fever, malaise, meaning fatigue, and swollen lymph nodes. And then about 1 to 5 days later, you start to get these blisters on your face and in your genital area. And those blisters really can be very pustular. They scab over time, but this takes several weeks. And so Mpox can actually be quite disfiguring for many weeks while you do have to isolate because it's contagious.
And it sounds just awful. Why are we seeing this surge now, and how concerned should the U.S. be?
Natalie, such a great question. We are seeing a resurgence of this Mpox in Africa, in the Democratic Republic of Congo, and it is a different clade is how we characterize these. It's a different clade than the outbreak that we saw at its peak in August of 2022. That was clade 2. This is clade 1. And it appears to be more virulent, more transmissible, and also more deadly. In fact, we've seen over 500 or so deaths in about 17,000 cases, which means that it is twice the death rate that we've seen in the previous clade. What's also interesting about this one is that we previously saw it mostly in men who are having sex with men. We are seeing it here in Africa. A large percentage of people who are being impacted are children. And we think this is because it is not only spread through sexual contact, it's spread through touch, contact with surfaces, bed linens, and many of these children in Africa have been displaced by war. They're living in encampments. They're unable to isolate. And so we're seeing it in a different demographic as well.
And so for anyone who's in that area, traveling to the Congo surrounding areas, what are some ways people can protect themselves and as well as others from Mpox?
Very concerning. The World Health Organization is very concerned. We now see it in Sweden. We have our first case in Sweden. It's only a matter of time before it's here in the United States. People who are at risk continue to be men who are having sex with men, transgender, binary population, but also people who are in commercial sex industries. By and large, the general public may not be at risk, but remember, once again, this is not only transmitted sexually. It can be also transmitted by contact, and it does live on surfaces for a period of time. So we absolutely want to be conscious of it, make sure that we understand what's coming. We need vaccines to be available. In Africa, there's a big shortage of vaccines, so we are asking all world countries that do not have the cases now to send vaccines to Africa, because if we can contain it there, we can slow the tide of how it marches across the West into Europe and into the United States. So this truly is a global interdependent situation scientifically, where we want to contain it in order to keep it from coming here to the United States and keep it from spreading once it does arrive.
Yes, well, medical officials will be watching this very closely. Thank you so much, Dr. Jayne Morgan, Vice President of Medical Affairs at Hello Heart. Thanks so much for joining us this morning.
Natalie.